Some Americans are concerned the Senate's proposed health care bill will take away their insurance. Joining us now is James Capretta, resident fellow at the American Enterprise Institute, where he studies health care policy. Welcome to the program, James.
Thank you. Glad to be with you.
The delay in the vote on the health care bill gives opponents more time to make sure it dies. What does the GOP have to do to make sure the bill passes?
Well, there's a few things. I think they need to reassure people that are worried about people having health insurance. So the bill does make pretty dramatic changes relative to current law. It's better than the House bill, I will say, in terms of providing subsidies for people at the low end of the insurance, of the income scale. But on Medicaid, the program that serves the very lowest income Americans, there is a pretty dramatic reform, which I generally support. But I think they may need to reach out a little bit more to the governors in the states that control the Medicaid program to try to sell their idea, maybe make some changes to accommodate their concerns, and make sure that it's clear to everybody in the country there will be a safety net of insurance for people.
Kaiser Family Foundation reports that more than 37 million children in the U.S. were covered by Medicaid in 2016, and the current bill includes cuts to Medicaid. So how do senators justify those cuts when they know it's going to impact children?
Well, actually, it's a complicated bill. It basically rolls back extra federal money for people that are childless adults and have incomes often above the poverty line. So it isn't necessarily aimed at children or the disabled or the elderly, as some critics are saying. It's really a rollback of the insurance coverage that was provided through the Affordable Care Act that was mainly, although not entirely, aimed at people with single adults who didn't have children.
Can you explain what this bare bones coverage plan is that a lot of people, that's what they're saying? And do you think that young people will buy these plans?
Well, this is a separate part of the reform, the non-Medicaid part of the reform for the regular insurance market. And in that, Senator Cruz and others are trying to allow states to come forward with regulations that will allow cheaper, low-cost plans to emerge. I understand the motivation for that, but frankly, I think it's likely to lead to a bifurcation of the market so that healthy people probably could get very low-cost coverage under those kinds of rules, but they'd be removed from the market that is subsidizing, in effect, the high-cost people. So the question is, can that be done without making the high-cost people pay a lot more? I think we're going to get an analysis of that pretty soon from the Congressional Budget Office, and my guess is it won't be very favorable. It'll say that the high-cost people are going to end up having to pay a lot more for their coverage if those regulations go into effect. That could be a problem for the bill. So, look, there's a few details here that still need to be thought through and understood carefully, and that's one of them.
Thank you so much for joining us. James Capretta, resident fellow at the American Enterprise Institute.
Thank you.